Welcome to the May 2015 Kaweah Delta Newsreel. This month, we'll learn from Patty Maldonado how the Nursery Nook on the 3rd floor of the Kaweah wing is making life easier for new moms. But first, Chief Executive Officer Lindsay Mann will explain how Kaweah Delta is expanding to meet the community's needs for healthcare.
Kaweah Delta is a remarkably busy place. I believe this reflects emerging community preference, not only from this community of Visalia, but from throughout the region for a number of our services. I'll give just 3 examples of areas that are in high demand and that are also the subject of our planning for expansion. Our emergency department this year will see 93,000 patient visits. That is one of California's busiest emergency departments. We are now in the active planning stages to improve the waiting lobby area, the triage area, and expand, in fact, into what we lovingly call Zone 4, a shelled area of the hospital that will be used to expand our emergency department. Patients will have better, more accommodating circumstances both in the waiting area as well as in the treatment areas. The NICU will be expanded as well. We're actively planning for its expansion because we now see over 4,500 births per year, some of which are challenged. Our NICU is a remarkably sophisticated place, but we want the physical environment and technologies to be upgraded so that we can handle more of these small NICU infants. Then, immediately behind me is the Kaweah wing of the medical center. The 5th and 6th floors are shelled. They will be finished with an additional 24 beds on each of the 2 floors, 48 beds, which will bring our medical center to a total bed capacity of 630 beds. This is needed because for the last 5 months of this year, we have been at absolutely full capacity. And as we add services like neurosurgery, non-invasive cardiology, improve our oncology and orthopedics programs and maternal child health programs, we will see additional demands placed upon our facility that must be accommodated by expanded bed capacity, as we will see in the 5th and 6th floors. All 3 of these important projects are now under very active planning for implementation in the near future. While each of these projects are now in the architectural planning stages, it will take some while to go through the state approval process and then have them constructed. But we're thrilled to be moving forward in the NICU, emergency department, and expanding our inpatient bed capacity. Each of these 3 areas are a reflection of our board's commitment to provide our community with the very latest in facilities, technologies, and scale to the demands that are being placed upon us. We are clearly this area's preferred hospital, and we intend to stay that way by providing superior service to our patients in each one of these areas. So in that respect, each of these projects, while they're architectural projects, are all about the patient in the end. I'm pleased to report that, consistent with our mission of providing safe, high-quality care, this week the Leapfrog Group, a national healthcare rating agency, designated Kaweah Delta as a hospital for patient safety. This is consistent with our hard work over many years to make sure that our patients in arriving at Kaweah Delta are provided with safe care first, then high-quality care. We have achieved this in several areas. There are 28 measures, but of the 28, I'll give just 3 examples. Medications being provided with accuracy 100% of the time, so the right medication, the right time, the right dose is consistently delivered. This is possible because of various processes between our doctors, nurses, pharmacists, as well as remarkable technologies. A second area, pneumonia. Patients having pneumonia at Kaweah Delta will have the necessary test to determine exactly how well the antibiotics are working and where the antibiotics are given with the most precision. We're pleased with this. Also relative to infections, we are at or above national norms in every measure of infection, but for CLABSI, central line associated bloodstream infections, we are at the highest possible level because of the great work of our physicians, nurses, and pharmacists. Just 3 examples of 28 measures that have been carefully evaluated across all hospitals in the nation, and Kaweah Delta stands out as an A-rated hospital for safety. We're very proud of this. A final comment, it's just the beginning of a journey. We're not standing on the summit, master of all we survey. Every single day, we put our boots on and work hard so that every single patient is enjoying the top safety rating of an A for their individual care.
The Nursery Nook is a place right outside the mother-baby unit in the Kaweah wing, 3rd floor. It's a place where you can find hard-to-find items, breastfeeding, questions can be answered, you get free weight checks. It's a support for moms, new moms. Here in the Nursery Nook, you can find breastfeeding supplies, infant clothing, gifty items for babies from grandparents, breast pump rentals, nursing bras, and other breastfeeding accessories. Here at Kaweah Delta, we promote breastfeeding and we strongly encourage it for every mom. Breastfeeding is beneficial for mom, for baby, for the family, and actually the whole community. Everyone benefits when a mom's breastfeed. Babies are healthier when they breastfeed. They have a lower risk of many diseases. They have a lower risk of diabetes, high blood pressure, heart problems later on in life. So it's definitely beneficial their entire life. For moms, their benefits are lower risk of breast cancer, ovarian cancer, faster weight loss, which I believe every mom looks forward to. You can sign up for these classes at kaweahdelta.org/Nursery Nook, and there's a link to sign up for these classes. You can also sign up by calling 559-624-6012, which is the Nursery Nook's phone number. After a mom delivers and is transferred to the mother-baby unit, they are provided with one-on-one assistance with breastfeeding. As soon as mom is having issues, one of our lactation consultants will go over to the room and will assist her, provide her breastfeeding education, and will help her to get her baby to feed. Once mom is discharged from hospital, she is able to schedule a one-on-one lactation consultation. She can call the Nursery Nook number and she will be seen by one of the lactation consultants and will work with her with any issues she has with breastfeeding. Here at Kaweah Delta, we offer a wide variety of classes for expecting parents, from childbirth to breastfeeding, infant massage, grandparents classes, infant classes, and nutrition classes.
That's the newsreel for this month. Thanks for watching, and we'll see you next month.